scientists are just beginning to learn the impact your gut and its delicate balance of microorganisms have on your overall health. And from what we know, it's a lot. Here with how to maintain and find gut health is registered dietitian Jen Belanger. Welcome, Jen.
Well, thank you for having me.
My pleasure. This is a hot topic nowadays.
Such a hot topic.
And I'm just wondering right off the bat, how do you gauge your gut health?
So this is a huge topic. So what we talk about today, we're really only skimming the surface. So how do we gauge gut health? Well, it's difficult. You know, it's not something as concrete as, you know, if we're talking about diabetes, right? If you have this number, you're diabetic. If you don't, then you're not. Gut health is really sort of this all-encompassing kind of determinant of overall wellness. And it's linked to so many different chronic diseases like obesity, diabetes, even mental health type of issues like depression, anxiety, even schizophrenia, Alzheimer's and Parkinson's. Yeah, so really the absence of chronic diseases is sort of how we could gauge gut health, but there's so much more to it than that. Yeah. So let's back up and talk about what is the gut, right? So we know that it's somewhere in the digestive system, but our digestive system is huge.
Yeah.
So when we talk about the gut, we're really talking about the stomach and the intestines. And in our intestines, we have trillions of bacteria. And that's a good thing. So for anyone who's listening who is like, oh, bacteria.
Germaphobe.
Yeah, exactly, exactly. And that was kind of hard for me to wrap my head around. I'm a germaphobe. So we have tons of bacteria. And so basically, we have these good bacteria that live in our gut. And they live side by side some of these bad bacteria that commonly cause infections, like E. coli, even C. diff. These are things that we see causing infection, especially in hospitalized patients. So really the goal is that we want our good, healthful bacteria to outnumber the bad stuff. And the way that we can make sure that we do that is through a lot of healthy lifestyle practices, including a healthy diet.
I bet there are lots of specific foods that help your gut. I mean, I think I've heard that fermented foods are something that's important. Tell me more about foods that can support a healthy gut.
Yeah, so when we talk about fermented foods, we're talking about things like yogurt, sauerkraut, miso, tempeh, those sorts of things. But honestly, too, fiber. Fiber is huge. I talk about fiber on the show all the time when I'm in the kitchen and with my recipes, right? So fiber is huge. So as humans, in and of ourselves, we don't digest fiber. But our microbes, which are the bacteria that live in our gut, they love fiber. That's what they eat. And so in order to maintain a healthful gut, what we need to do is make sure that we're feeding those microbes food that they can eat, which is fiber. Most people don't get in enough fiber. So that's really a goal of almost every patient or client that I see is working on their fiber intake.
Very interesting.
Yeah.
You know, you also hear a lot in pertaining to gut health about probiotics and prebiotics. Can we address those two things and what they are?
Yeah, so prebiotics are what feed healthful bacteria in the gut. So fiber is a prebiotic. It feeds those healthy bacteria. Probiotics are typically in the form of supplements, and you can get those over the counter. And those are actual live bacteria that you take in either a liquid or a pill form to support gut health. The interesting thing, though, about probiotic supplements is that use of them in people who are otherwise healthy and have no sort of GI condition like ulcerative colitis or Crohn's, the probiotics really don't do much, which is so interesting. So probiotics are really only beneficial, perhaps, for those people with GI conditions. But otherwise, if you are maintaining a healthful diet, getting enough fiber, sleeping, exercising, all these things that we talk about in terms of general wellness in itself, you're really helping your gut health in that way.
Is there anything that would tip you off if you did have a disorder or disruption in your gut health, something that you might need to check with your doctor?
Yeah, so, you know, if you're someone who, like IBS is a big one, right? So if you have either constipation or diarrhea, that could be a sign that your gut health isn't as great as it could be. But something so interesting too, so we talked about, you know, like depression, anxiety, schizophrenia, those types of things. So our gut is actually in constant communication with our brain via something called the gut-brain axis. And so we see that people who suffer from depression, anxiety, often have this dysbiosis in their gut, which is the bacteria is kind of out of whack, which is what dysbiosis means. And so like something interesting, serotonin, right, is our feel-good hormone that's actually produced in our gut So people who suffer from depression may have this dysbiosis where they're not producing as much serotonin.
So you might want to check with your doctor if you're feeling sad or depressed, and also ask for a physical checkup as well, sounds like, right?
Yeah. So it's important to rule out any sort of actual GI condition going on, like inflammatory bowel disease or Crohn's disease or something like that. But working with a dietitian, of course, too.
The way to go,
yeah,
right? Thank you, Jen.
You're welcome. Thank you.